Hello, family and friends. With our previous discussion, we ended with the following question. Why do Black children drown at a much higher rate than white children? Well, according to USASwimming.org, 70% of African Americans do not know how to swim. And guess what? When parents have minimal or no swimming skills, there is an 87% chance a child will not learn how to swim. The YMCA reports that higher drowning rates in Black children can be attributed to a history of racial segregation within municipal pools, a lack of representation within swim sports, and an inherited fear of drowning. And when you look at annual household incomes, 79% of children in households with incomes less than $50,000 have few to no swimming skills. According to PewResearch.org, they report that the median income for Black U.S. households is approximately $47,000, whereas the median income for white U.S. households is approximately $75,000. Now let's look at factors that can increase your risk of drowning. Not being able to swim, ineffective barriers around pools, lack of supervision, not wearing life jackets, drinking alcohol, taking certain medications, and illegal drugs. Some medications can increase your risk by causing drowsiness. Certain medical conditions like autism, seizure disorders, and heart disease put you at a greater risk for drowning. Drowning is the leading cause of death in autism for children and adults. Drowning is the most common cause of unintentional injury death for those individuals with seizure disorders, and the bathtub is the most common site of drowning. A Canadian study revealed that fatal drowning victims had a median age of 44 years and 80% were male. The most common preceding activities were swimming or boating, and the most common bodies of water were lakes or ponds. The victim was usually alone, and 1/3 had a pre-existing condition such as cardiovascular disease, physical disability, or seizure disorder. Since heart disease is the leading cause of death for men, women, and people of most racial groups in the U.S., it is important that people with heart disease speak with their physician before engaging in water activity, and always do so in a supervised setting. Well, that's it for today. See you next week when I will discuss drowning prevention.